You are listening to Scott H. Silverman's Happy Hour, a podcast released on the first 3 Wednesdays of the month. Family crisis, relationship crisis, addiction crisis, no two crisis situations are the same. They vary by family, individual, and relationship. They can encompass complex family dynamics, emotional distress, anger issues, and entitlements, and often involve substance abuse. This podcast addresses these issues and others surrounding the addiction epidemic currently plaguing this country and the world. There is hope and help.
Are you stuck, scared, or unsure of what to do next? If a situation with a loved one, spouse, or even a child has started to spiral, possibly becoming dangerous or threatening, it's time to seek help. My name is Scott H. Silverman. I help families navigate crisis situations. I'm the person you turn to in order to get you and your loved ones unstuck.
Welcome back to Scott H. Silverman's Happy Hour. This is Michael Glenn Moore. I'm Scott's co-host. Scott, today we have more than one guest, don't we? We have, 4 guests?
Well, if you're going to count yourself, Michael, we'll go with 4. Otherwise, I see 3, but I'm going to go with your math today.
Oh, you're right. I guess I have my eyes crossed.
Don't worry about it. How you doing, Michael?
Doing pretty good.
Good. Everything cleared up from all that storm and all that rain and all that wind?
Well, we still have holes in our roof and holes in our ceiling, so we're still waiting for the contractors to come out and start work. That should happen in about a week or so.
Well, me to you, that hat looks good, so keep it on just in case.
Yeah, I'm going to need it.
Anyway, so want to say hello, good morning and afternoon to everyone. My name's Scott H. Silverman. This is Happy Hour. We call it Happy Hour because that's what we're going to make it, although we do it in 30 minutes. So this is a very special group. Today we have actually 3 guests. Before I get into intros, though, I want to make sure you have our contact information. Please reach Michael anytime, and he'll give you his info as we go through the segment. And please reach me at 619-993-2738, yourcrisiscoach.com, or Scott H. Silverman. Just Google me. Please let us know what you think about the show. Let us know what you'd like to hear about, what you'd like us to talk about. Our big focus is around behavioral health, mental health, substance abuse, and getting access to treatment. That's what we like to focus on, but we'll take some, redirection, some other ideas and suggestions if you like. So today we have 3 special people, and I got to tell you, I've been nervous for a couple of days thinking about this. This is really Happy Hour's first group interview, if you will, group podcast, and asking our guests, a couple of them said they've never done this before, but I know they've been in front of the media for a long time, and you'll hear why as they explain what they do and how it's done. But first, I'm going to go through a quick resumes, bios here. Linda Beridgeman-Smith has been a member of the San Diego County Prescription Drug Abuse Task Force since it began in 2008 and is currently co-chair. San Diego County was one of the first regions in the country to identify and begin to address opioid crisis. The Prescription Drug Abuse Task Force initially began as an Oxy task force in 2008 when parents, schools, law enforcement, and representatives from local county and federal agencies convened to address the growing problem of OxyContin and oxycodone abuse. The group soon realized that a problem was not just the misuse of oxy medicines. To address the emerging prescription drug epidemic in San Diego County, the group reframed its mission to address and reduce harms from the misuse of prescription medications, changing its name to San Diego County Prescription Drug Abuse Task Force in 2010. Welcome, Linda.
Thanks.
Next, we have Nathan Painter. He's a clinical professor at the UC San Diego School of Pharmacy. Pharmacy, folks. So all of you drug seekers out there that are listening and watching, no, he does not take calls. And he's also the clinical pharmacist at UCSD Family Medicine Clinics. He's an executive member of the San Diego County Prescription Drug Abuse Task Force, as well as co-chair of the Healthcare Committee. In addition, he's a trainer for the California Pharmacists Association, CPHA, and has partnered with California Board of Pharmacy to train pharmacists on furnishing naloxone through the state. Dr. Painter has been recognized by CPHA and American Pharmacists Association for his work educating healthcare professionals on the opioid epidemic. Nathan, welcome to you.
Thank you very much for having us.
I think you have an audience in the back. It'll be nice to hear from them as they move through the house today. So they're all welcome. Yes. And next is Marla Kingkade. Marla and I, we go so far back, it is scary. When I first got into the nonprofit world, Marla was one of the first people I met. And we've worked together indirectly on and off now for decades. So Marla, it's welcome to you here today. Marla Kingkade has worked with law enforcement mental health communities in San Diego County for 34 years. So she started when she was 10. Good for you, Marla. Marla has developed several programs for law enforcement jurisdictions involving mental health issues, including juvenile division programs for El Cajon Police Department, La Mesa Police Department, San Diego Police Department. In addition, Marla implemented the Psychiatric Emergency Response Team, PERT, for San Diego County law enforcement agencies. In 1996, Marla implemented the PERT program from the San Diego Police Department. In 1998, the PERT program became countywide, involving several law enforcement jurisdictions, including the San Diego County Sheriff, San Diego Police Department, and La Mesa Police Department as well. Marla was the public relations officer for La Mesa PD at the time. Marla currently works in San Diego County District Attorney's Office. Congratulations, what a great move that was. She is responsible for the development and facilitation of de-escalation and crisis management trainings. Boy, is that needed today. Everyone, I'm sure, will agree with that. Also, in addition to her work, District Attorney's Office, she facilitates the Meth Strike Force and the Prescription Drug Abuse Task Force. Marla is president of the California Crisis Intervention Training Association, CACITA, and a member of the Board for Survivors of Suicide Loss, SOSL. Marla and her husband, Steve, a law enforcement officer for 33 years, have been married for 27 years. They have twin daughters, Laura and Nicole. And I won't tell you how old they are, because if I do, Marla, I'm sure I'm going to get in trouble, even though you wrote it down here. So welcome to our guest today, and I want to thank you all very much for coming and being part of this today. And I'm looking forward to the information I know you're going to be sharing with our listeners and our guests. So our first question, and by the way, one of the things that I do, which irritates some of our guests, and sometimes it doesn't, is I ask them to submit questions. And the reason I like to do that is I want to know what's on their mind. What is it they feel our community needs to hear more than anything else right now and right here? And we're in 2020, in the middle of a horrendous pandemic. And obviously it's an election year. I don't know how that ties together, but it's put a lot of stress and a lot of friction, and a lot of behavioral health issues have come up. We know overdoses are up, alcohol sales are up 60%. So people are self-medicating. So what this group does and what they do in this particular portal is really, really critical. So we're going to start with Linda. So Linda, can you please give us a little bit of an overview and history on the PDATF? Thank you. It's all yours.
Thanks, Scott. And I'm really delighted to be here. And I'm very proud of the work that we have all done in San Diego County with the Prescription Drug Abuse Task Force. It began in late 2007, 2008, where there were a number of sectors in San Diego County that were looking at this drug problem. There was a couple of spates of drug overdoses amongst young people, high school students and college students, that age range. And so the sheriff was looking at some information. The health department where I work was looking at some information. Local schools were looking at information. And there was really this opportunity for these different groups to get together and have kind of a conversation about what everybody was seeing. And that those conversations, when it was recognized that this really was a problem in the region, it wasn't a one-off, and that there was something that we all really needed to take a look at, the membership at that time included the District Attorney's Office, the San Diego County Sheriff's Office, a couple of local municipal police department contacts, the San Diego County Health and Human Services Agency, the Drug Enforcement Administration, some local parents and school administrators and teachers. And we really just sat down and had a conversation about what it was that we were all seeing, and recognized that this was an issue. So over the course of about the following 6 or 8 months, we had some community forums and discussions about the issue, and decided to form the Oxy Task Force. And that Oxy Task Force was renamed to the San Diego County Prescription Drug Abuse Task Force in 2010, when in the beginning, we honestly didn't know what we didn't know. And in fact, we really as a group got criticized quite soundly by our local media, because we were overstating the state of the prescription drug problem. And that was in 2010. So it's really interesting that in 2017, a national declaration of an opioid epidemic was declared. So in many ways, I guess San Diego County was the canary in the coal mine. Today, we have really, and I'm very proud of our very broad partnership. It includes the United States Attorney's Office, the District Attorney's Office, the United States Attorney's Office for the Southern District of California, the District Attorney's Office, UCSD Medical School, where Dr. Painter is a professor, a number of coalitions and grassroots organizations, other federal, state, and local law enforcement partners, the healthcare system. We have some healthcare providers who are on our group, as well as some insurance providers and some state boards. And it's a robust group. We get together quarterly in a public forum, and now that we're online, I'm sure Marla will talk about, it's open to anybody who's interested. You just have to be hip to the West Coast timeframe. And the purpose was really to coordinate and collaborate together across the public health and public safety sectors to provide some information to the community about what is Prescription Drug Abuse Task Force, what is harmful regarding prescribed medications, and putting some things in place to really provide information to the community at large. We promote prevention efforts and substance abuse treatment. And one of the other things that we think is really important is some thoughtful policy solutions.
Awesome. So tell me, Linda, I know that, through Safe Homes Coalition, the nonprofit that I work with, we've done a lot of, connecting as much as we can nationally. Is it safe to assume that other communities, not only throughout California, but nationally, do similar things? I think we have one of the more robust programs historically, from the platform that, everyone that in this group has been involved with has been around for quite some time. But have you been able to find sister cities or brother cities across the state that do similar things, that have been able to share information with our local group and us with them?
Yes, San Diego County is one of many coalitions in the state. I think that, Marla probably has a better handle on this than I do, but I think there's 15 or 20, and they are in a variety of development, I guess, but the state of California actually has provided some seed money. In San Diego, we got started before it was sexy, if you will, so we have never really been a recipient of that public funding. We just use our own resource to identify what's needed and work together to solve a problem collaboratively.
Very good. Well, on the sidelines, Marla and I are working on a couple of things to see if we can get some more than seeds, a full crop of resources here in the community.
Awesome.
One of the things that I've learned in my years of working is if you don't have data, if you don't have evidence, if you don't have information, it's really hard to convince the legislative leaders, the decision makers, the thought leaders, those who are really embedded in helping create systemic change. And one of the reasons, I'm just a volunteer, and I've been coming to this group for, I don't know, a few years. And the reason is because I like the idea of the data that we get. Nathan, I know you were very involved with the survey. Would you mind sharing a little bit about the purpose and the goal of the Safe Disposal Survey that was done between, was it February and April of 2020, according to my notes here? And you had like 1,245 surveys, which is a significant number when you think about how many people probably don't know that they're interested in this topic, but we build awareness through information. So please share a little bit about that.
Sure. So this survey, this is the third iteration of the survey. We've been trying to do this survey every 2 years to try to gauge safe disposal practices, awareness, and opinions on various questions that we'll go through in a minute. The good thing is that even though there's not a lot of data to really compare across the country, we've been pretty consistent in San Diego and in some of the surveys all across the US about some of the information that I'll share as far as percentage of people who are aware of things when it comes to safe disposal options, or what to do to dispose of medications safely.
So how many prescriptions, just, another question as a follow-up, then let's get into the unwanted and unused piece of it. But what is the number? How many prescriptions do people take per day based on the survey?
Based on our survey, the average number, about 83% were taking at least one medication a day. About a third of them take 2 or 3 medications a day. About 15% take 4 to 5 medications a day, and as many as 12% take 6 or more medications per day.
Okay, and that's
so
it's a big thing.
It's a pretty appropriate population that look at it. About 20% don't take any medications, so it's very pertinent because most of the people that completed the survey are taking at least one medication.
And these are prescription medications, so I'd be willing to put some money on the fact that the other 20% may be taking medications that are not prescribed.
Absolutely. The survey question specifically was about prescription medications. So this does not include herbals, vitamins, supplements, all those things. You can, I don't want to say guarantee it because again, we don't make assumptions when the data we don't have, but we know that there's a lot of people that take over-the-counter medications that don't have prescriptions.
Right. Well, of course, anecdotally, marijuana is now legal in California, and we know that methamphetamine is made just south of the border. So we won't go there because that's not our theme today. So what do people do with their unwanted or unused prescriptions, Nathan? Because I know, the idea, it's especially California, you can't put it down the toilet because if it goes down the toilet, it goes in the water system. And if you throw it away, it goes in the landfill. And if you give it to a neighbor, they may abuse it. And, I've always heard stories. People say, I don't want to get rid of my medication because I don't know if I'm going to need it again. And most people, according to doctors, don't actually even finish, whether it's a 7-day or a 10-day. They tend to, if they feel better, they stop taking it, they put it away, and it sits in the medicine cabinet. So what do people do with their unwanted and unused prescriptions?
Yeah, there's a couple of good and lessons learned, I think, with this survey. Unfortunately, still the most frequent answer was to store them at home. So just as you mentioned, people may not finish a course of antibiotics, they may not finish a course of pain medication, and they want to save it for just in case something happens again, which is, on one hand, you understand people want to save money, they want to save time, but the chances of them having the exact same issue is very low. And so we really highlight that you don't keep medication just in case. You do need to be evaluated by a doctor if something comes up because it's likely different. Or if it's the exact same infection or exact same injury, it needs to be reevaluated because, clearly something is not being taken care of, or, we don't want to miss something as far as a medical emergency, or something else going on. So we strongly discourage people just storing them at home for future use. And the other piece that you mentioned is just that people don't finish things. And that goes with antibiotics or short-term or acute medications. But unfortunately, that goes with chronic medications as well for things like high blood pressure, diabetes, etc., because of side effects, because of, you name it. There's a variety of things that can happen. And so again, they tend to just kind of stay at home just in case. And that presents its own unique problem because patients, their blood pressure may no longer be at goal. They may start to experience other effects of untreated health conditions that we don't even know about. So, but back to the survey, the other good thing that we did find is that when you added up all of what we would consider appropriate disposal methods, which includes taking them to the annual DEA Take Back Day, which I think we'll talk about more in a little bit, taking them to local law enforcement, or taking them to a pharmaceutical waste disposal site, that reaches about 50% of the respondents. So about half the people have actually said, or more than half the people have said that they basically take it somewhere for somebody else who's legally able to dispose of those medications for them. So that's the good news as part of that. But that also means that there's about 30 to 40% of patients who are either don't know what to do with them or are doing what we would consider, less desirable or incorrect ways to dispose of medications.
Can you give a couple examples of where somebody would potentially take medication that's unused or unsafe, or if they don't know where they're going? And I know one of the things we talked about when we met earlier this week is if you're not sure what to do with medication, it should be treated just like jewelry or cash. It should be in a safe place. It should be a place where your kids can't get to it, or you have friends that come over, or if you're, a grandparent, you have grandkids come over. Because drug seekers, unfortunately, or even accidentally getting into a medicine cabinet. Safe Homes Coalition years ago was started around the idea that people were with the San Diego Associated Realtors Association, because people were actually going into an open house and going to the medicine cabinet. People know that people lock their jewelry up and their valuables up and their cash, but people don't do that. In some of these, higher level scheduled dangerous narcotics that are very, very addictive still sit in medicine cabinets. And according to the data, you'll love this, Linda, and I know you're going to check it. In 2016, 264 million prescriptions were written in this country, 264 million prescriptions. And, the CDC did a little survey, but there really wasn't, an anecdotal long-term survey or study, but they say the inference is, and I cleared this with some friends I know in law enforcement, roughly 61% of those prescriptions still sit in medicine cabinets. And that may be some data that Marla shared with us one day on a PowerPoint that I had to sit through in one of those meetings. So Nathan, give us some examples. Where can somebody, today, they're hearing our voice, this will be out in a couple of weeks, and where can they take medication thinking, I never thought about that. That's been sitting there all these years. And, I do have grandkids now, and, I just had a prescription filled, and there was someone in my house cleaning, and somehow it left the house and I didn't know how. So what can people do, like, fast track real quick right now? A couple quick suggestions.
Well, first, before I do that, sorry to go off your question, but I do want to highlight, because you mentioned this, the medicine cabinet is the worst place that you can keep your medicines for a number of reasons. One is not even counting the safety of somebody who might just walk into a guest or somebody, or a friend even, or your children walking into the medicine cabinet and taking something. It's often in your bathroom, which can get very humid because of showers and actually degrade the medication. So number one, your medicine cabinet is the worst place to keep medicine. So thinking about your actual question, some of the things to think about are, if you have young kids, really just keep it high and away from high traffic areas or areas that your kids cannot get to. If they're young kids, this is talking about accidental poisoning, accidentally getting into medicines. If you have a closet that's out of the way, that's high up, way out of their reach, that's where you should keep your medicines. For example, even if your kid is sick, you really shouldn't leave the medicine at the bedside for, in case that child were to actually get into that medicine. As you get a little older, or as other kids or other people are in your house, again, keeping it in a relatively secret area that's away from high traffic is good. But if you can, if you don't have access or you don't feel safe about where the medicines are, keeping them in any kind of safe or locked drawer would be the next step to do. It doesn't matter what kind of safe. It could be a specific safe that's designed for medications. It could be a safe where you keep your jewelry. It could be a safe where you keep other things in your house. It doesn't matter, but somewhere that can be locked and kept safe.
Great. Very helpful. So who talks to people about safe disposal?
This is another one of those good and bad things. The bad part of this answer is not many people are talking about it. In our survey, 83% of the respondents said that at least a healthcare provider did not talk to them about it at all. So that includes the physician at the prescribing end and the pharmacy and the pharmacist at this site of dispensing. And so patients just aren't really being told about this. I'll get to the good part of the question in a minute, because there is some positive news coming out of this. But when you break it down, physicians and pharmacists are the top two healthcare providers that are talking to patients. But again, only 11% out of those surveyed said that a pharmacist or physician or another healthcare provider actually talked to them about how to dispose of the medication. The good part about it is we, especially around the semi-annual DEA take-back days, we do a lot of media attention and a lot of word of mouth and a lot of stuff in our neighborhood in San Diego to get the word out about the DEA take-back days.
Do you have that date by chance, the day and date and time for that offhand? Somebody must have that here.
Yes, I do.
It's Saturday, October 24th.
Okay, so it's coming up, it's about a week before Halloween. as a benchmark for those who may forget. So and that's done nationally. And the Department of Justice, the DEA, pretty much promotes that in every region, I think, that they can. And I know this group, obviously, because we meet, every other month, and we talk about it in great depth as well. So that's what, but again, I want to push you a little bit and I'm not sure I got my answer. If somebody needed to take something today out of the house, where would they go? I mean, I have some ideas, but I want to hear you. I want it to come from you, so people can't say, "Well, Scott keeps telling us, and we're just not going to keep listening to him." And it's important because, for example, I know there are drop-off boxes around the community right now, and I know obviously with COVID things are restricted in some areas, but there's a couple places I'm sure off the top of your head that when somebody hears this in a couple of weeks, they can go, "You know what, Martha, we have got to go get this stuff to the CVS." So tell us more about that, Nathan.
Yeah, there's two main places that you can take your medications pretty much year round. One of them is going to be the drop boxes like you mentioned, and those are in various community pharmacies. There's a couple of big chains like Walgreens and CVS, just to name a few, that have take back boxes all over this country. You do need to go to their websites or to the DEA website to find out specifically which one might have an actual take back receptacle, because not all of them have them. And you cannot take it back to a pharmacy that does not have a drop box. Pharmacists are not allowed to take back drugs directly. And the other one is many law enforcement, sheriff, city police, other agencies, other county and city agencies also are able to have take back boxes. Again, with the COVID, there's some concerns about different areas being open. And so even if you find out that a law enforcement office has a take back box, I strongly encourage you to call to find out updated hours before you go and are disappointed because the doors are locked.
Got it. All right, I'm going to skip this next question because I want to get to Marla, and actually it's amazing how quickly this our time is moving. So Marla, what are the concerns and or dangers of keeping unused prescriptions at home?
I think Dr. Painter said it beautifully in his responses to your question, Scott, that anytime there are unused, unwanted medications left in the home, there is a potential of those medications getting into the wrong hands, whether it's a child in an accidental overdose or an individual seeking those medications. And so we want to make sure that by promoting safe disposal, by promoting safe storage of needed medication, that it is one way that we can protect our communities and really help support our substance use disorder prevention program that we have, not only here in San Diego County, but I think all communities can represent this. We also feel that, medications are given to individuals specifically for their height, their weight, their illness. And so sharing that medication can be harmful, even when you do it with good intention. So whether it's taken without your knowledge from your medicine cabinet or you then share it, there is potential harm to that. And we really want to get that message out. And then what we haven't talked about this, but we also would like to just make one statement during this presentation about our counterfeit pills, and that medications need to come from your doctor, from a pharmacy, and not a pill from the street or shared by a friend or even a stranger. The counterfeit pills oftentimes are very, very dangerous, and we have now seen increased cases with counterfeit pills laced with fentanyl.
And the overdoses, and I think I just heard from one of the assistant DAs just last week, we lost 3 young people in our community. Yes. And they are taking, exactly, I had that on my mind, counterfeit medication. And, for those of you who are wondering, what does that mean? Well, an example would be someone's giving you a Xanax. Oh, I need something. Oh, here's the Xanax. Well, that particular Xanax might be bootleg, might be made in someone's garage, and it might be cut with fentanyl. And that's what we're seeing. People are taking medication that's disguised as some other medication because people think they'll sell better because they understand what Xanax is or Valium is, but most people won't necessarily take fentanyl by itself unless they're fentanyl seeking. So to Marla's point, when you go out and you're socializing, to be informed. And this is information, you know, I'm thinking about the topic we have. People are thinking, well, this is kind of narrow. This doesn't apply to me. Well, if those 264 million prescriptions I was talking about were truly written, and they were written by licensed professionals, DEA approved writers through pharmacies, doctors wrote them, they're sitting somewhere in someone's medicine cabinet. I mean, when I heard years ago, I think I first heard it at the task force, pediatric morbidity. I mean, what a scary phrase. What does that even mean, pediatric morbidity? And, you know, and I had to ask the question, young people expiring because they were exposed to some prescription medication, accidentally, on purpose. And, you know, we haven't even talked about it today, but animals getting into edibles, animals getting into medication. And, you know, if we spent half an hour talking about that, I'm sure we'd have a much broader audience. But at the end of the day, you know, we have to treat medication that's prescribed just like we would anything that's important to us. You know, your hair color, my kids get their eyebrows done, you know, my receding hairline, I focus on it daily, the elastic in my pants from the weight gain from COVID. These are things I think about every day. And we have to, if we're going to reduce the morbidity rate, we're going to have to start having these kind of conversations, and having you guys come on today is real important to me. And we're hoping that this information is going to get to a lot more people. And I'm certainly going to do my best to make sure that takes place. So Marla, before I pull it away from you, anything else from you at this point?
Well, thank you for the opportunity. It's an important message to get out, not only here in San Diego County, but really across the country, that we need to safely store our medication, use it as prescribed, and dispose of it when necessary and appropriately.
Well said. So Linda, it looks like you get the last word according to my questions here. San Diego highlights, lessons learned, next steps.
So I think of all the things that I'm proud of that that this task force and that this group has done, one of them locally that we did is it was a policy plan, and that was, we in San Diego County, we have since 2010 permanent drop boxes. That is a county ordinance that was passed in 2010, and so every sheriff's office in San Diego County and the jail facilities, as well as the county administration center, which has sheriff deputies in charge of the drop boxes, are repurposed mailboxes that are specifically used for the disposal of medication. And those are available, as Dr. Painter spoke about, those are available in law enforcement settings because the current federal regulation requires those medications be in either in law enforcement's hands or it be in the person whose name is on the prescription bottle. And all of the other local municipalities in San Diego County also have permanent drop boxes. And we spoke a little bit about overdoses, and in general, you know, there's really two categories in my mind of overdoses. One is a fatality where someone dies of that overdose from a prescribed medication. The other is a group of people that we don't really talk about a whole lot, but those are the survivors who have had an overdose, but they have survived, and they may have some significant health problems, physical problems, and may never ever be what they were before the overdose occurred. That changes, of course, an overdose changes everyone's life. But when there's a death in the family, that changes the family dynamic, as does a survivor who is permanently damaged as a result of a prescription drug overdose. That changes the family dynamic forever as well. And we need to remember those people also.
Yeah.
Thank you for sharing that. So in closing, what I want to do before I turn it back to Michael is I want to give each one of you 15 seconds, and I'm going to watch you specifically, Linda. 15 seconds. If you had a magic wand, I'm going to let you go first, Linda, then Marla, then Nathan. If you had a magic wand, if you know, somebody said, here's a magic wand, Linda, with everything you've learned, with all the experience you have, what would you do with it right now to help create systemic change, build education, and help prevent? Because everything we've talked about today, to me, is totally preventable. And with education and prevention, we can avoid people accidentally getting access to things that can kill them. I mean, I don't want to oversimplify it, but it could be that simple. And if we're going to create systemic change, we're going to have to talk about it. So 15 seconds, you had a magic wand, what would you do?
encourage every single person who is sitting in front of a healthcare prescriber and they're offering you a medication, ask questions. Why? And how long should I take this? And what are the side effects? But ask those questions. That's really important for you individually, is to be really knowledgeable about your own health and wellness.
Awesome. 17 seconds. I knew it. You always grabbing more. Marla? How about you, Marla? Magic wand. What would you do with it?
My magic wand, I would simplify it and enhance that communication between our physicians, our pharmacists, and our community, and have an open, honest dialogue about safe disposal to keep our families and our community safe.
Great. Nathan?
Try to encourage people to keep crap out of their body, to be quite honestly, whether it's poor food, alcohol, marijuana, drugs, whatever it happens to be. Take only what you need and be healthy.
Great. Linda, disclaimer, you know, I pick on you sometimes, and someone says, why does Scott pick on some people? He says, because he really likes them. He really likes them. So Michael, back to you, brother. What did we miss? Questions you have? Thoughts?
Well, I do have a question for Dr. Painter. What's unclear to me is once you've dropped off your drugs to a designated location, what happens then? Since you can't bury it or flush it or burn it, what do they do with the medication?
Yeah, so there are specific federally licensed disposal companies that have a very specific process of how they collect those drugs. So they'll go to a take-back box, which is locked. There has to be typically 2 people that watch them collect the sample and also put it into a locked container that then goes into the truck. They take that to some federally licensed disposal place. And then there's only 2 or 3 licensed facilities in the country that are able to actually dispose of these medications. And so once they kind of, again, in this locked facility, once they reach a certain level, they take it all to these licensed facilities where they are destroyed, which is usually through incineration.
Okay, that's something I've always wanted to know. Does somebody have a positive quote for us today, or we're going to get Scott to give us one?
You don't want me to give you one. Linda's
I have one.
Oh, God. I forgot to write one down. Go, Linda.
This is gonna close this out. So when you're done, we're gonna stop the recording.
The magical theme, my magic wand, and this comes from the infamous Professor Dumbledore. Happiness can be found even in the darkest times if one only remembers to turn on the light.